I'm Jode Freyholtz-London with Wellness in the Woods, and we participated in a group of providers and concerned citizens in Wadena County probably almost a year ago now, about a year ago. And we're talking about some of the challenges with providing support to individuals who were in mental health crises, and some of the people who were at the table were law enforcement and folks from the local hospital, ombudsman, individuals from Wadena County Human Services, and we were trying to come up with some creative ways to support people that did not require high-end resources. Some of those that were identified would be emergency rooms or calling 911 and using law enforcement, only because that was the only system that we had in this community. So in response to that, Wellness in the Woods did some research about what peer support could look like and how we could actually look at creating some venues and some resources in this community. We looked at a number of other states in the United States and what they had for peer support warm lines and actually the success rate. We did some research with Arizona and Recovery Innovations and saw that individuals who had peer support saw a drop in hospitalizations and emergency room visits by from 40 to 70%. So when I looked at the numbers that Tri-County gave us at looking at about 250 hospital emergency room visits at, just say $2,000 is kind of rounding up, but that's a lot of money. And when I talk to people who use the emergency room, they're like, that's not necessarily what we want to use as a resource, or not calling 911, but we didn't have any other options. So in response to that, we started having conversations with both Wadena County Human Services and Todd County Human Services, and have a number of different phases that we hope we will be able to implement with providing support from other people who've had a lived experience with a mental health challenge. Our first phase in that is called the Peer Support Connection, which will be a telephone warm line, and that will begin October 1st. We have information on how to access that, and so we want to make that available to community potential referral services such as the hospital emergency room and law enforcement and Wadena County Human Services. To start with, we met with a number of individuals who may have used services in the past, and they identified that the time they need the most support right now is from 10 at night until 6 in the morning. So that will be the starting hours on October 1st. There will be an 800 line, and the people staffing that particular warm line will actually be individuals who've had a lived experience and have went through training about how to support someone else. Now we're going to work closely with the crisis line and referral services so that they will be able to refer people to us when someone really just needs someone to talk to, and we'll be able to make that referral back if someone needs crisis services or to talk to a mental health professional or mobile crisis outreach team type services. So our goal is really to give individuals in our community the opportunity to have a service that is going to prevent them from using those higher end resources, and they can connect with earlier on with their mental health challenges. Our next step is certainly going to be in getting legislative support and funding through hopefully block grant dollars to provide a peer respite in central Minnesota. We right now have the support of Senator Paul Gazelka, should he be reelected, to be a chief author for a bill for legislation that would support a peer respite in Wadena County, and Representative John Purcell, who is also up for reelection but has agreed to be a chief author. We have presented to the Governor's Mental Health Task Force and given them a packet about how this would absolutely meet the needs of individuals before they are in crisis. Plus, it would offer a number of employment opportunities for individuals who have identified as having a mental illness, and so we would be providing work opportunities as well as a place that individuals could be supported. We are going to be also providing that information to the Mental Health Legislative Network to add to their proposals to the legislation in year 2017. And we are providing that information to the State Mental Health Advisory Council so we can get commitment from them. We have, in other meetings that we've had to provide this information, it was suggested that we contact the Minnesota Sheriff's Association and the Minnesota Police Chiefs Association to get support from them, because that's certainly one of the community supporters who are saying that we need this kind of support in our community because they're not quite sure how to support individuals either. So we are moving forward. We plan to get support from all of those individuals as we move into the legislative session. And we have support from Senator Tony Laurie as well, who is the Chair of Health and Human Services. So there's certainly some pieces that are fiscally responsible as we provide an option for individuals that are not the high-end resources, and also so that individuals who are serving people in the emergency room can do what they were trained to do, which is stop blood flow and start hearts and get people breathing again, and so that those of us who need that support will have a place to go. And in response to law enforcement as well, their job is to serve and protect us, and they're kind of often at a loss as to how to support somebody who may be dealing with a mental health challenge. So we hope to provide that type of support, and also to glean information about how we can additionally provide support around this new peer support connection. Once again, the number will be available October 1st. The number is 844-739-6369. 844-739-6369. And if you need cards or information to hand out to people that you may potentially serve and will use this resource, please connect with me, Jode Freyholtz-London, Wellness in the Woods. My phone number is 218-296-2067. I'd like to introduce you to Carrie Johnson, who will be the program director for the Peer Support Connection. Carrie, you just want to say hi?
Hi.
Carrie is joining us on board to do not only the scheduling, but she will stay connected with the individuals who are trained to do peer support connection work. All of them are peers. They will have a level of high values and ethics that will follow. We will also ensure quality assurance by having individuals from the community call and access the Peer Support Connection phone line and give us some feedback about the work that we're trying to do. We have a number of other counties who are also interested in Minnesota, but we're going to really focus on Todd and Wadena right now so that we are sure that we have everything in place that we need to do. We'll be collecting data about the people that we serve who are calling us, gender, age, what county they're calling from, and then are we able to meet the needs that they want to need. We have heard from not only law enforcement, but other medical providers, that there are folks who come into the clinic in the emergency room and really share that they just need somebody to talk to. And so we are hoping to provide that kind of support. And then move from there into developing the Peer Respite in central Minnesota. We know that there are certainly a number of areas where there are not enough services, and so we are hoping that as a consumer organization, we can try to start providing some of those services. So Sarah, did you have some questions that other people might have also?
I guess one of the questions that would come up is there going to be an actual location, or is this more just a phone line? So, I mean, will there be a location where people could go to, or is it mainly just a phone-based service at this time?
At this time, it's a phone-based service, but when we get legislative funding, which we're bound to do, our goal is within the year to provide a place. The Peer Respite would actually be a house where individuals could go and stay from about 1 to 5 days. There will not be any diagnostic assessments, no med management. It will just be a place where folks can go for a respite. And we have talked with Peer Respites across the United States, and they have some amazing success rates for supporting people. We can help them develop their wellness plan if they'd like to do that, and this finding ways to connect them with other resources in the community. And maybe that resource will be that the people that we're supporting will start some kind of a new peer support group. We're also working closely with Wadena and Todd County and their drop-in centers.
Okay.
So we'll be able to help people get connected with kind of peer support connections and resources that they may not be aware of. And maybe the ones that they are aware of aren't working for them, so how we can help them to develop peer support connections that do work for them. Because maybe the person who needs that support is an 85-year-old retired farmer, and he doesn't feel comfortable going to a drop-in center where everyone there has been hospitalized a number of times, and he's just really struggling with depression, and he really wants to just talk to other retired farmers who are feeling that they don't have a purpose anymore. So we'll try to connect them with resources that are in the community, and then hopefully help to create new ones where that needs to happen.
Great. One other question I guess would be is, with the peer support connection relational, so certainly the phone-based, is there any in-person support that could be offered to individuals?
Not yet.
Not yet, okay. So that's also something.
But
that
that's also part of the plan. What we're finding is that especially emergency rooms are asking, is there someone who could come and be with people? Because we know with the shortage of beds and accessible services, that sometimes folks who are accessing services like the emergency department just need somebody to be there with them. And emergency room staff is busy doing things that they need to do, and they don't have the time or the skills to provide that kind of support. So we are encouraging both hospitals and the county to talk about how we can work together to provide that kind of resource. Certainly using certified peer specialists in an arena where they may actually be, maybe they're going to do front end desk work, or and then can be utilized if somebody comes in having a mental health challenge. So there's a number of ways that we could be creative about that. We know that the Mobile Crisis Outreach does a great job, but that's not always who we need to be there. We don't always need somebody to come and do an assessment on what kind of diagnosis we have. Sometimes we just need a human being to sit there with us for a while until we feel better.
Yes, and I think we definitely see that often. And we see the patterns, so some of the same people who this just has become their learned resource.
Yes.
And we're certainly there to serve the need if they've identified that they need to be there. However, sometimes it's, if they've got that support in place, we're able to safely return them to the community and know that there's a follow-up plan for them so that they don't need to
Absolutely.
lengthy ER stay
Yes,
or anything
yes.
like that. Yeah.
And we know that that's definitely a concern for a person like myself who's sat in ER for a long time, and as I visit around the state, I'm hearing ER length stays as long as 2 weeks, and I just can't imagine that would be helpful for anybody, not the staff and certainly not the person receiving services. So we also hope that during that time, once we have this connection with people, that we're going to be able to provide them with those actual peer kinds of tools that those of us who've been there are using now, so that we don't end up in the emergency room. And maybe that will be connections we haven't even thought of yet. Maybe it'll be a theater group. Maybe it'll be, having coffee at the cyber cafe. I'm really open to whatever that looks like, but that's certainly the next step in this kind of processing and what that will look like. So we are ready to go. We have 8 people who will be trained in not only what does it look like to provide peer support, because our support will look different than the crisis line. The crisis line is really important for people who need extra resources. but we're gonna be there if somebody just needs somebody to talk to. And I worked as a volunteer in the crisis line for probably 8 years, and sometimes people just called and said, I just needed to know somebody's out there and they care. And so that's part of the piece that we want to start offering in Todd and Wadena County.
Great.
October 1st.